Hi, my name is Jason Shiflett. I work for Physical Therapy and Balance Centers of Germantown, and I'm going to talk about migraines. Migraines are headaches. Sometimes they're one-sided, but they're pretty severe and incapacitating. They're often paired with vision issues, auras. Some people can see flashing lights. They can also come with gastrointestinal problems, nausea, vomiting, diarrhea, constipation, and just abdominal cramps. There are three reasons why migraines occur. Three theories. One being that it's a dilation of the blood vessels in the skull and face. That's reason one. Reason two could be chemical irritation of the trigeminal nerve, which is one of the cranial nerves, cranial nerve 5, which has three branches. Right here, ophthalmic, maxillary, and mandibular. And then the third reason is gastrointestinal, GI, food allergy, sensitivity type causes. It's found that the third reason can stir up reason 1 and 2. Basically, chocolate, sugar, all different things can trigger the gut nerves or the gastrointestinal nerves to cause a reflex arc, which then causes a sympathetic nervous system response in the head, dilating these blood vessels, giving you a migraine. The cranial nerves and the nerve part in the face can be affected. So those are the three reasons for migraines, basically. So if a patient comes in for migraines, I like to scan how much of the migraine is coming from those three reasons. Sometimes, and usually, it's a little bit of all three. Sometimes it's only one. Sometimes it's two. Drill-in is going to be my model today. First one I want to check, as I discussed earlier, is how the gastrointestinal or allergies in that system can flare up the other two causes or reasons. So the way I do that is using viscerosomatic reflexes. So on the left side, I'm going to poke there, and most people will jump there. Not just for migraines, for many other reasons. She's definitely tense on the first one, not so bad on the second one. That's for stomach on the left side, but orthopedic somatic dysfunction coming from a visceral cause. 10, 9, and 8, T10, 9, and 8, both sides, a little bit there. Will clue me into small intestine, Chapman reflex, and this is what I was talking about. So between small intestine, stomach, if there's a GI cause, these are going to be flared up, and that tells me there's one reason. That can send the reflex up to the neck, head, and skull, giving the neurological and then the vascular component. You can really quickly check the trigeminal nerve just by doing this is cranial scan. It's under the counterstrain method, fascial counterstrain, just by resistance on the zygomatic process. And then you can jump right into testing the vascular component to that, venous, lymphatic, arterial, by checking the same vein, basically. So the left side moves with the right side has a hard end feel. And that's telling me that there is a neurological component to it of three cranial nerves, not just trigeminal. That one also registers as a facial nerve and vagus nerve. And then up here will tell me lymphatic, venous, both sides, a little bit of tightness here, and that's head, neck. And then I can jump down here and check cranial arterial. And she's tight neck there. And I can actually just palpate the actual structures. And she loves when I do that. That hurts, right? Mm-hmm. Yeah. So you can use the skull as a map, and then I would go into treatment. Other factors I didn't mention that can cause migraines are weather changes, stress, lack of sleep, diet, and dehydration. So as far as treatment goes, he popped up with all three areas, a little bit of everything, as I always see with this. So right there, tender. All right, so she's thick and she's tender there, and that's telling me there is a GI component to this, which is sending that reflex arc up here and causing issues up here. All right, lay on your back for me. I just have 2 fingers on the back, and I'm and then 2 on the front. In between the inner spaces that correspond with the back. And we're gonna treat it in 3 phases. Go after all 3 reasons. we break it up into 3 causes for it, and then prioritize them and then treat them one at a time. There's also a diet that I usually recommend, which will include, it is called the Candida Cure diet, but it basically is a summary of all the rules and things that can inflame the body, especially the GI stuff. Good for fixing a lot of things. Only address one of those components, the main component, but that will turn that reflex arc down somewhat, which will decrease muscle tension in the neck, which we can then jump right into circulatory part of that migraine. I use a lot of manual therapy to do that, but the key is to decrease muscle tension, restore proper circulation so there's not an overflow of blood flow going to the brain or dilation of the vessels, then balance out nervous system through similar techniques. Some of them in the neck, some of them in the skull. Many doctors will always recommend pharmaceuticals for this, and some patients are aware that massage can help a little bit. Acupuncture definitely, but a lot of people are not aware that there's a whole world of manual therapy techniques other than massage that are extremely effective for this. Really getting at the root cause and not just the symptoms. And that's the way we like to approach things here. So I jumped from the neck right up into the skull. These techniques are very gentle, they don't hurt, and they release tension and restore alignment in both the spine and the cranium. I used to get migraines, very bad migraines. The only way I get a migraine now is if I have too much chocolate or fried food. Refined carbohydrates are some big causes. Gluten, different things, but a lot of people aren't aware of that, and that's why I attached diet at the bottom that really helped me out. Take it in baby steps if you try to follow. So if you are suffering from migraines, there are options, many of which you may not have known or your doctor may not know. We do try to apply a very thorough, unique approach to migraines. A full body approach, basically. And one thing I add is this, I follow this, and it has changed all kinds of stuff. This has helped me a lot and has reversed a lot of problems in my body, including migraines. So, and give us a call if you are having migraines or if you have questions and you need to discuss them. So we're here for Fyzical Therapy at Germantown.